Hi, my name is Emmanuel Cruz. I'm an assistant professor at the Pontifical Catholic University of Puerto Rico, and today I'm going to be talking about some research that I did during my tenure as a postdoc in the Cristina Alberini Laboratory at New York University. The title of my presentation is CIM6P IGF-2 Receptor Ligands Reverse Deficits in Angelman Syndrome Model Mice. So IGF-2 or insulin-like growth factor 2 is a peptide that is critical for memory formation and plasticity. Previous studies from the Alberini lab show that so localized administration intrahippocampus of IGF-2 promotes memory or enhances memory. And they did so by doing the spatial memory task inhibitory avoidance. They did surgery, they did the inhibitory avoidance task, and then they injected IGF-2 intrahippocampus. Then they tested memory 24 hours later and 7 days later. When we did so, you can see the control here. They have this amount of memory, and then you can see that IGF-2 groups have enhanced memory. When they also administered IGF-1 as a control, and there was no enhancement in memory. So meaning that IGF-2 selectively enhanced memory. This was in the 24-hour test, but then also when they test the 7 days later, you can also see that the enhancement is sustained at 7 days by IGF-2, and that IGF-1 doesn't do anything. So it's in that specifically IGF-2 enhances memory. This is when it's administered into the hippocampus. Next, they tested whether subcutaneous administration of IGF-2 can also have similar effects. And they did so in mice. Basically, they injected the IGF-2, they trained the mice in a different memory task, and then they tested memory 24 hours later. And in this case, they did contextual field conditioning memory, novel object recognition memory, and social recognition memory. And in all cases, administration of IGF-2 enhanced the memory. So it seems that systemic administration of IGF-2 is a potentiator of memory, and it's also something that can be more therapeutic, as it can be injected subcutaneously and have a similar effect as to when we inject the intrahippocampally. So based on this enhancement in memory, we tested the potential role of the IGF-2 receptor in neurodevelopmental disorder, focusing on Angelman syndrome. So Angelman syndrome is a complex genetic disorder that is primarily affecting the nervous system due to loss of function of the maternally inherited UB3A gene. And this leads to symptoms such as developmental delay, intellectual deficits, repetitive behavior, lack of speech, walking and balance disorder, and mainly also leads to seizures, which is one of the biggest problems that these patients encounter. So it has been a mice model for this disease has been developed that has the maternally UB3A gene mutated. And in this mouse model, it has been shown that it has all the same symptoms and that are observed in patients. So in our studies, we're gonna use this mouse model and test the efficacy of IGF-2 and the role of the IGF-2 receptor in this disease. So the IGF-2 receptor, this will be a picture of the IGF-2 receptor. And as I mentioned before, IGF-2 is a peptide, binds to it and activates it. But there are other ligands, such as mannose phosphate, which is a sugar that also binds to the receptor and activates it. And this leads to basic activation of the receptor and leads to also the phenotypes that we are seeing, like enhancement in memory. So we're gonna test whether administration of both of these ligands of the IGF-2 receptor have some effect in the Angelman syndrome. So in our next slide, we're gonna talking about these effects after administration of IGF-2 and mannose phosphate. So first, we did the novel object recognition task, which is a non-aversive spatial memory task. In this task, we put the animals first in a box, and they habituate in there. Then we wait 24 hours, and we inject either IGF-2, mannose phosphate, or the control solution. We wait 20 minutes. And for this experiment, or experiments, the injection is subcutaneous. So we wait 20 minutes after the injections, and then we train the animals. And we train them by exposing them to the same box, but in this case, there will be two objects that are identical. Then after training, we wait 4 hours, and we expose the animal to the same box, but in this case, one of the objects will be changed. This will be the new object. And usually animals will have a preference to explore the new object. So they should have a higher percent preference to the new object. And then 24 hours after training, we also tested again with a new novel object. And for the purpose of this presentation, I'm just gonna mention what happened in the test that is 4 hours after training. So as you can see in here, we have two graphs. We have one that will correspond to IGF-2 and another one that will correspond to mannose-6-phosphate. As you can see, in normal mice, administration of IGF-2 compared to vehicle doesn't have an effect. As it is known, Angelman syndrome might have memory deficits, so they have lower preference to the novel object. But then when we inject IGF-2, we are able to rescue this deficit. So it seems that IGF-2 rescues the deficits, memory deficits in Angelman syndrome mice. When we did mannose-6-phosphate administration, we did not have the enhancement in memory in wild-type mice, but we have an impairment in Angelman syndrome mice compared to the wild types. Then when we administer mannose-6-phosphate, we have the rescue in memory in these mice, in Angelman syndrome mice, meaning the activation of the IGF-2 receptor, either with IGF-2 or mannose-6-phosphate, results in rescue in memory deficit of Angelman syndrome mice. And this was in test number 1. In test number 2, we also observed the same thing. So now that we know that the memory deficits are reversed, we wanted to know whether other type of behavior are also reversed. So for this, we did we tested motor coordination and balance using the rotating rod, in which is a device in which we put the animals into a rotating rod, and then it becomes faster and faster. And then as it becomes faster, the animals tend to fall. And then we measure the latency to fall from the rotating rod from the animals. Usually, Angelman syndrome mice, since they have motor problems, they will fall from the rotating rod faster than the wild types. So in this case, we injected either IGF-2 or mannose-6-phosphate or vehicle solution 20 minutes before the first test. Then we tested 2 days later, and then we tested 3 days later to test the sustainability of this, the drug administration. For the purpose of this presentation, again, I'm gonna focus on the first test. So in the first test, when we inject IGF-2 or mannose-6-phosphate in normal mice, we don't see any effect. As expected, the Angelman syndrome mice have deficits in rotor rod performance, and they have lower latency to fall compared to the wild types. Interestingly, when we add IGF-2 subcutaneously, we are able to rescue these motor deficits in the rotor rod. Same happened in here in the mannose-6-phosphate group. The untreated Angelman syndrome mice, they have deficits in the performance, and they fall faster from the rotating rod. But when we inject the mannose-6-phosphate, we are able to rescue this deficit. Again, showing that activation of the IGF-2 receptor with either IGF-2 or mannose-6-phosphate leads to a recovery in motor performance by this mice compared to the counterparts treated with vehicle. And when we tested, this was sustained when we tested 2 days later or 5 days later. So next, we tested the effect of IGF-2 and mannose-6-phosphate in seizures. It's known this disease is characterized by the patients having seizures. So we injected either IGF-2 or mannose-6-phosphate or control solution, and we tested. And in this case, we did audiogenic seizures, in which we put the animal in a cage, we scrap the lid of the cage, and this will create a sound. And the sound will lead to seizures in Angelman syndrome mice. It will not lead to seizures in wild types, and it will look like this. You saw there were two phases, a phase in which the animal was running uncontrolled, and then a phase in which the animal is paralyzed. So the first phase is the while running, and the second phase is the tonic-clonic seizure. And we measure the presence of both in animals, in Angelman syndrome mice that were treated with vehicle or with the IGF-2 or mannose phosphate. So interestingly, Angelman syndrome mice that receive this treatment, that receive the vehicle, they have 100% seizure when they are exposed to this seizure protocol. So they have the seizures. But when we add the IGF-2, the while running is reduced by 50%, and the tonic-clonic is reduced by 70%. So it seems that IGF-2 have a very strong effect in rescuing seizures in these mice. When we did mannose phosphate, we did not have the rescue effect. And this could be to a couple of things. Maybe the dose is not perfect. Also, maybe so we need to do a dose response, and also maybe the binding site of mannose phosphate is not the same as IGF-2. Maybe it's not the one that is able to rescue the seizure phenotype. For this, we filed a patent for IGF-2 as a treatment for seizures. So finally, as a summary of the results, we see that IGF-2 reverse intellectual deficit in the form of memory. It also reverse motor deficits and seizures. In the case of mannose phosphate, we saw that it rescued memory and motor deficits, but it did not rescue the seizures. And we think that maybe a different dose or finding out why this happened, it will be very important for our future studies. Finally, I would like to thank Cristina Berini and her lab, particular emphasis to Dr. Helen Schaffman, which is an expert in seizures, and help me go to the protocol. I would also like to thank FAST, which is the Angelman Syndrome Foundation, and the NIH for funding. Thank you so much.